Good evening and thank you for joining us tonight for our 18 News digital exclusive State of the Virus. I'm George Stockberger. As cases of COVID-19 continue to rise across our country, 18 News is giving our viewers an opportunity to ask local experts their questions regarding COVID-19. Today we're joined by Dr. Jeremy Lux, the chair of Arnett Health's Department of Emergency Medicine. Thank you for joining us, Dr. Lux.
Thank you for having me.
So, Doctor, we've seen reports of the virus continuing to spread, and right now we are in a second or even third wave here in the Twin Tiers. What are you seeing on the front lines at Arnett?
Definitely over the course of the last couple of months compared with earlier this year, we've had a large number of patients with coronavirus compared with before. I think we were relatively spared early on in the course of things, perhaps from early shutdown, perhaps because of the population density being different than the cities. And we were spared a large wave early on compared to what we're seeing lately.
Okay, and with that being said, if people have health concerns other than COVID-19, is it safe for them to come into the hospital, whether it be for a checkup or a regular exam?
It definitely is. We take a lot of extra precautions in order to make sure that patients are kept safe. One of those things that we are doing are limiting visitors. Currently with visitors in the emergency department in particular and other areas are not permitted unless there are extenuating circumstances where somebody needs a specific advocate, somebody to help with them, to speak for them. Of course, then that's a different story. Pediatric patients, of course, a parent is allowed, and also in other certain extreme situations of severe health crisis. But other than that, it's rather limited. We take a lot of extra precautions as far as wiping down surfaces and cleaning surfaces and the like as well, in order to make sure that it's a safe environment from a virus standpoint.
All right, our first question from our viewers comes from Nicole in Horseheads. She asks, are people who test positive safe to return to work if they are still exhibiting symptoms after their 2-week quarantine?
That's a difficult one. It really comes down to the symptoms themselves. For the most part, if you're still having a fever, the answer is no. Generally speaking, the recommendations are 72 hours after your last fever would be considered a safer time for returning to work. If you still are having severe respiratory symptoms and a lot of cough, it probably is ill-advised, especially because, if anything, even if you're not overly contagious, which the answer is we're not entirely sure there, it would be for your coworkers, I think, a very uncomfortable environment as well. So it'd be good to try to limit that as much as possible if you're exhibiting severe symptoms. Mild symptoms, a little bit of scratchiness of the throat, maybe just some dry respiratory changes without having severe cough and congestion. It would be a different story, but that's a difficult one to completely answer because it's a case-by-case scenario and also depends on where you work.
And for yourself, doctor, how are you protecting yourself when handling the virus when you're going home and when you're at the office?
It's a lot of precautions and a lot of bleach. So there's a lot of sterilization procedures that I personally do for all of my objects. I try to keep all of my work stethoscope and other equipment that I use in the hospital, in my office, and I wipe it all down. In the hospital, we wear personal protective equipment with masks, face shields, goggles to cover our eyes. If we're in with a patient of suspicion of coronavirus, we wear gowns also to cover ourselves, which then covers our clothes. Generally, I also I change. I have different scrubs that I go into work with compared with what I go home with. That way, I'm not wearing them potentially contaminated scrubs on my vehicle because I'm going to protect myself and my family as well.
All right, and so one of the big questions that people have right now, of course, this being the holiday season, is Thanksgiving next week. Do you think it's safe for people to have those traditional family gatherings and those large dinners?
I think traditional needs to change a bit. Is it safe? It depends on the situation. Very large gatherings are discouraged strongly, especially for those that may be frail or have comorbid conditions that would be a higher risk of complications if they were to contract the virus. I think a lot of smart decision making and common sense comes into play. If you have symptoms, even if you have suspicion of you have, maybe it's just allergies or something like that, it might be better to stay away and confirm that. I think your family would thank you if you think of their safety and their health first before anything else. There are a lot more Thanksgivings to go after this one, and you want to make sure everyone is there for it. I think that's a big part of it, is making sure if you have any kind of symptoms is to avoid it. Large gatherings, like I said, are very strongly discouraged, and small gatherings with some smart decision making, keeping a little bit of distance. I know it's hard not to hug this time of the year, but try not to overdo it, I guess, and just be smart. That way, you have many more happy occurrences of people getting together for the holidays for this point forward.
Of course, and now our next viewer question comes from Travis in Waverly. He asks, if you are in quarantine, is it safe for you to go outside if you're wearing a mask, say to take a walk or take your pet out?
I would say safe for you. It's safe for you. Is it safe for others? That's the question. Should not be around anyone, even with a mask on, if you're under quarantine, until you were either under quarantine and confirmed you were coronavirus negative, or until you were outside of your quarantine period, whichever, if you have symptoms, you're confirmed positive. Generally, recommendation would be if you want to go outside, stay in your yard, go on the porch. If you see somebody else, you should maintain 6 feet or more away from them. No stopping and talking, no contact. You really want to look out for others, and just as much as you would want others to look out for you if the situation was reversed. So going outside isn't necessarily going to hurt you very much, but you want to make sure you don't harm others in your activities. If you must and absolutely need to go outside and go for a walk down the sidewalk, although not recommended, if you're going to do it, again, common sense, be smart about it. Try to do it in off hours when people aren't going to be outside as much, early in the morning, later in the evening, and just really try not to be around others.
All right, and now our next question here from a viewer comes from Faith, and she's in the northern tier. She asks, why do some of the swab tests go further up the nostril, and does it affect the results of the test if it does not go as far up?
Yep, that's not an uncommon question that we're coming across, and why does it need to go so deep on some of those tests? Some of it comes down to the type of test that is being run, and if it's the way that the actual testing media is used, and what the assay is in order to do the identification of virus particles. Some of them require a deeper swab than the other ones, and it depends on which one is being used at any particular time. As long as whatever test is being performed is performed correctly, and the sample is being handled appropriately throughout the chain of events that lead to the test actually being conducted, then the efficacy and the quality and the results are very reliable at this point. But it comes down a lot of doing those samples correctly. Even if it's a deep swab, and you have to make sure that it is indeed a deep swab, as uncomfortable as it can be. But it just depends on the specific manufacturer of test and type of test that you're receiving.
Bob is asking about the death rate, and he says, has the death rate dropped since the pandemic has begun, and if so, why or why not?
It's difficult to say if specifically the death rate overall has gone down. If you look at it from the raw numbers, we have more deaths occurring lately because more people are contracting the virus countrywide. And in our area, that definitely is the case. The overall rate, however, is going to be different now than it was earlier in the pandemic, when we didn't have the resources to test appropriately. So we have more tests being performed, which will catch more positives, but at the same time will also catch more negatives. So it changes everything just based on that testing. Plus, the testing strategies early on, because of limited resources, were very limited to people that had symptoms and had a high suspicion of having the infection, versus now we'll test people even if they had an exposure, they need to return to work, if they have allergy symptoms. So there's a lot of other things that can go into it to change that.
All right, well, Dr. Lux, thank you so much for joining us today. And viewers, if you have any questions regarding COVID-19 that you would like one of our local experts to answer, you can email us at news@wetmtv.com. We'll have more on the fight against COVID-19 on 18 News and mytwintiers.com. Thank you for joining us, and have a good night.